Hey, how are you doing, Melanie? Good to see you. I just got started, so I'm gonna. I open Blackboard. You can hear me, right, Melanie? Okay. All right. So I open Blackboard, and if you go to important stuff, and then Nurse Prac program, then it lists all these different documents that are really helpful. All right.
Lindsay?
Yes. Hey.
Hey, I have a question. I might be jumping the gun here.
Well, it's okay.
On this women's health section,
Mm-hmm.
what if we did a practice that like is a rural practice clinic that does women's health?
Yes, that's fine.
Okay. I mean, do you have to do so? How do you determine how many psych out? I mean, how do you figure all that out?
So really the main component of primary care too is women's health. So you're going to want to try to get out of the 120 hours, you'll want at least 75 to be women's health. The remaining can be either psych or family practice.
Okay.
And we know that sometimes it's hard to get a psych facility. So, if you finish out with family practice, that's fine. But if you're able to get psych, that'd be good. And, any patient you see that's depressed throughout the program, you could always log them as a psych patient. I was talking to Dr. Toon earlier, and she said like depression, anxiety, and ADHD, those sort of patients, you can log that as psych.
Okay.
Yeah.
Well, what about on the women's health? Just anything. I'm sorry, I've got a gnat in front of me.
Okay.
Anything that's related to anything with the women, with the woman.
Yes.
issue. I mean, so if they come in with a breast issue or anything like that,
yes,
just anything that has to do with. Okay.
Yes.
I was wondering how that worked. Okay.
Yeah.
So here's another question.
Yes.
So I managed to get all the way through undergrad and work as a nurse for several years, and I've still never actually seen anybody born. So like if I found a nurse midwife in the area, and could I do part of my hours with a nurse midwife?
Mm-hmm. We do have students that work with midwives. So yeah, definitely could do that.
That would be awesome.
Yeah. Okay, so just go through. By the end of the program, you're going to have the 150 PD hours. So the 30 remaining from primary care 1, if you see a patient in practicums 1 or 2, or if you're doing family practice, say you're in primary care 2 and you're at a family practice that sees all ages and you see a PD patient, you can go ahead and log it as PD, and that will count towards the 150 hours. Okay, by the end of the program, you'll have the total of 675 hours. So this document, are y'all coming up on, y'all are doing diagnostics this summer?
Yes, ma'am.
Okay, cool. All right, so this document that I'm showing you right here is the very first one in the Nurse Prac program on the Mission Possible. Okay, the second document is created by Dr. Toon, and let me pull it over here. It's a Word document with just some helpful tips. So how to get a preceptor, start early. She does list an email here that has a script if you're interested in using that script. And her main suggestion when I talked to her today is just to try to branch out and get to know people outside of your own clinic where you're working, or, try to network. And she recommended volunteering at faith-based clinics and the Red Cross and or you could even maybe volunteer at a hospital outside of where you're currently working. She said that's helpful. So if you wanted to take a look at this, there's also strategies for success in the classroom and in your courses regarding like how much you should study or spend time in Blackboard, that sort of thing. So that's the second document. This next document is all of our approved facilities. Melanie, where do you work? Or where do you live?
I work in Queen City, which is near Texarkana.
Okay. So I want to show y'all this document. Open it over here. Okay, so here are all of our active facilities. So as you can see, we have all of these in Austin. And then let's scroll down to Texarkana. Okay, so we have all of these in Texarkana.
Okay, great.
So there's some good options there. If you come across a facility that's not active, I'm going to show y'all what to do in that case. But I try to keep this updated. I'll upload this. I've had 4 or 5 since I last updated it in March. I don't think in Austin or Texarkana though, but I'm going to check. Okay, the next item is a preceptor list, and it's a Google document. And as you can see, it was updated like almost 4 months ago, so I need to get that updated for y'all. And I'm going to show you where the best place is to look on Typhon, and that's going to have our really up-to-date list, because we've had several preceptors who they're not letting students be as hands-on as they need to be. So Dr. Toon asked me to remove some people, and if you were to have a bad experience at a location, you just let us know and we'll make sure that we update our preceptor list. The next item is the preceptor form, and I opened it right over here. Actually, when you click on it from right here, it'll open to the internet. Okay, so you will fill this out. You won't use this form for diagnostics or advanced health assessment. Those will be done on campus. And they should be your instructor should let you know pretty soon what dates those are that you come in. So like advanced health assessment, you'll come in and we have our labs, and you'll probably give each other in the class full body assessments.
I just did that today, yeah.
Okay, yeah. So you won't use this form for that. You're going to use it for primary care 1, 2, 3, and practicum courses. Okay, so you just go ahead and fill it out. Include your student ID, your program semester, just all of this. The course, there are some courses, let's see. Okay, I'm glad not all. Some of our older courses, they used to show up. They don't show up any longer. So just make sure you're picking the right one that goes with the right course. And now I'm going to update this for fall. Right now it's saying summer. Once I know who the instructors are going to be, I'll put their names so you can add them right here. What happens once you submit this form is one copy will go to you, and one copy will go to your preceptor, and one copy will come to me, and then one copy will go to your faculty member. So you'll have records, and what happens is your faculty member will take a look at who you're wanting to work with and where, and then they're going to decide whether to approve it, which, 95% of the time it's approved. And then, or if they have questions, they'll let me know, and then I'll let you know. And then your preceptor, what they receive, I'm going to pull up a copy of what they receive for y'all. Let's see.
Lindsay, while you're doing that, I've already found a preceptor for the fall. Should I go ahead and fill this out?
Sure. That'd be good.
Okay.
I'm starting to get fall coming in. This is the email that was sent to this preceptor, and it says, hello, please review your credentials. And then what they're going to do is they're going to forward this email to my attention. And just down in the email, they're going to type in their name and the date, and they'll send it back to me. And then what I do is I forward it back to them, and I CC the student, and I will also sign and date it. And then I put like, thank you for being a preceptor. This has been reviewed and approved. And see right here, I CC Lisbeth, which is the student. And so she knows that all is good to go to start in the fall. And then I just recommend maybe keeping these in a folder in your email. Okay, so that's what's sent. You'll go through here and fill out the professional license number. If you're not sure, say you have a preceptor in mind, you're not sure what their license is. If you want to say it's a nurse, okay, we're going to click right here. And it's going to open up on the Board of Nursing site. And let me see what this person was. Mariah. Let's see. Okay, I'm going to show y'all. If you were to search for this preceptor, I just showed you her email, and you weren't sure what their license is. Now, it came up, and this is the advanced practice license number. But if you click on View APRN record, it will also show just the regular RN 6-digit number. So you can use this on the form. And then it says that this license is active through November 30th, 2017. Also, if you're not sure, I have to check all of them. So say you come up with a preceptor and they have a disciplinary action against them, I will let you know. And it depends on what that is, like on the Texas Medical Board, if it's a physician, and they did not do their CE or they did not pay for their renewal of their license fast enough, that sort of thing, we don't really worry with those sort of actions. But if it's something really serious, normally the instructor won't let you work with them. But it doesn't happen very often. Okay. So that's just if you're not sure what their license is, you'll check either on the Board of Nursing or Texas Medical Board. Okay, and just fill all of this out. If you put in the facility name and address, and then when you get to this part right here, is this facility already on the approved list? And if it is, you're going to click yes, and then this bottom part will disappear, and you won't have to fill all this out. If you click no, there's some additional information that I will need, like who the contact person is, so that I can go ahead and start a facility agreement with them. Okay, and then I check this, like coming up, since summer's coming up, I'm going to be checking all the results daily. And what I do is I upload the results into a database, and I will automatically, if your preceptor is not currently in our Typhon system, which I'm about to show you, or if the facility is not currently active, I'll automatically start the process of getting that all approved. So, and you can check in with me, and usually I will send an email saying, or CC you, and like whenever I email a manager, I can CC the student and let them know that, okay, I am working on this process. So, okay. Do y'all have any questions about the preceptor form?
No.
Okay. All right, so let me go back to Blackboard. Okay, next is the Typhon log instruction. So, I don't think yet either of you are in Typhon. Is that right?
I'm supposed to fill it out in a week and a half, so this is great timing.
Okay.
Yeah, me too.
So,
that'll be great.
Yeah, I'm going to get you added to Typhon. This is my part. This is what my screen looks like. So I'll add you as a student in Typhon, and what I do is it'll send you an email with your username and password. And the very first time you log in, it's $80, and that activation fee lasts your whole program. So there's that. And then once you log into your student Typhon, this is what it looks like. Okay. All right. So I wanted to show y'all how, let me first start with directories. If you're not sure if the clinicals, let me just show you right now. Okay, clinical site directory. I'm going to click on that. Okay, this is going to list all of our current active facilities, and you can change this to city if you want, and it'll list it instead of in alphabetical order. It's going to list it all in order by city, so that's helpful. So if you want to take a look at this before you maybe go to a facility, you can do that, or you can go back to that Excel spreadsheet. And then also the same thing with the preceptor directory. So these are just helpful little, again, you can sort it by specialty, or you can sort it by city. So it is helpful to see who has precepted before. Let me just show you. Right here, see this Nabil Abakar? The license doesn't expire until 2017. So this preceptor most likely precepted in the fall or in the spring. These down here, let me find one. Like this one expired February 28, 2015. The reason why it hasn't been updated in the system is because they probably haven't precepted in a while. So if someone's in here and their license expired in 2012, it's probably a good sign that they aren't at that same location, or they might not be precepting for us any longer. So here's one from 2014.
Can you look at mine just so we can see her if she's in here?
Sure. What's the preceptor's last name?
Hooten, Hooten.
Okay, yeah. I think that Sunny Hooten?
Yes, that's her.
Okay. Yeah, I think someone actually used her this spring, so it's all up to date and everything.
Oh, great.
You know, it's kind of awkward sometimes asking the preceptor all those little details about the license number and everything. So it's nice to have all of this in here with these are her exact credentials she wants on her preceptor certificate. So it's just good to be able to have all this in one place. Okay, I'm going to go back.
I have a question for you.
Yeah.
So it's written in stone that we have to have like 2 nurse practitioners, and then the other has to be an MD, a DO, or a PA. I mean, you can't have like all nurse practitioners anymore.
You can. So if you can complete the program with only working with nurse practitioners, that's probably going to be a really good experience for you. But sometimes students have found that they can't get every single class and all their hours with only nurse pracs. So that's whenever they might use a PA or
So it doesn't really matter what discipline you get them with, just as long as you get it.
Yeah, and you just have to have at least half of your hours for the whole program with a nurse prac.
Oh, good. Got you. Okay, that's awesome.
Yeah.
I was wondering about that.
Yes. Okay, so I'm going to go back to the main menu, and now I want to show y'all how you're going to enter your case logs. So this is for each patient that you work with, and you don't have to enter them the same day that you see your patient, but it is helpful if you go ahead and get it done so you remember everything about them. So I'm going to go ahead and click on Add a New Case Log. Okay, so I'm going to enter that I saw this patient today. Okay, make sure you enter the correct semester and the correct course. I know sometimes I've seen recently a student entered all of her practicum hours under one course. So one course is showing up that she has 240 hours already completed for spring, but they're all under practicum 1 and there were no hours for practicum 2. So just kind of try to divide that out. Okay, so I'm going to do practicum 2. You'll select your preceptor, who you're working with. Let's see. Trying to find, okay, here we go. Put in your clinical site. You'll go ahead and put in the age. I'll just say 30. I'm going to say I'm seeing a male. Insurance. Just filling everything. You will want to start using these ICD codes so that you get some good practice doing this. And so it depends on what you're seeing. So let's say we saw someone with a mental health problem. Let's just say anxiety. I don't even, y'all know I don't know all this stuff.
You're doing great.
You're doing
Generalized anxiety disorder, everybody's got it.
Billing code, same sort of thing.
Oh, wow. I didn't realize this was so complex.
Yeah. Well, you know, you might not, you know, the goal is when you're done, the ones you use most regularly, like say you see a lot of influenza patients in the winter, maybe by the end of the winter, working in family practice throughout the program, you'll know the exact code to just quickly put it in. But
now, when we fill it in for health assessment, these 20 hours, do we? I mean, there's no way to fill all that out. So
good question. Good question. What you will do is you will list your preceptor as your clinical instructor this summer. And what you're going to do is you're only going to fill out one of these case logs. And you're going to put all 20 hours on one case log. And then for the other course, you're going to put all 30 hours for diagnostics. Okay, so make sure you put all the time that you have with the patient. Dr. Toon asks, so say you see 8 patients a day and you work for 8 hours. Well, go ahead and put in that you spent 60 minutes with that patient. So that includes time with your patient, and then it also includes time for charting. And by the time you start the program, you'll probably see 1 patient an hour, and that includes charting time. And then by the end of the program, the goal is seeing a patient and charting for a total of 30 minutes. So hopefully by the end of the program, you cut your time in half. So that's sort of the goal. Okay. Student participation, we really want to see, you know, at the beginning, when you start with a preceptor, you might be observing a little bit or sharing information with your preceptor, but hopefully by the end of the semester, you're the primary caregiver. Okay, so that's pretty much, you're not going to worry about this birth and delivery medications. If you want to, you can check off some of these boxes, social problems addressed. You're going to select whether, okay, I put that I saw a male in his 30s, so I'm going to put adult patient. And that's where your hours are going to pull from. So if you saw a pediatric patient, it's going to, you know, log those hours. Okay, clinical notes. I'm going to put I saw 8 patients. So this is what you'll do for each. Yeah, you in each case log. So you're going to enter, 8 different case logs for one day because you saw 8 patients. But in the clinical notes, make sure you write how many patients you saw that day because that's going to come up in a report. And that's just so that your instructor will know, like, if you're at a facility where you're only seeing like 1 or 2 patients a day, they want to make sure that you're getting the experience you need, and they might not allow that facility to be a future facility that's used. Okay, so what I'm going to do now is I'm going to save the data. And what pops up is you can click on My Time Logs. And it's saying, let me see here, did I miss something? It will tell you if you miss something. Oh, yeah. What you have to do is you have to create a time log for your day. I know this seems like a lot, but you'll get really fast at it. Okay. Okay, so you clocked in 1,500. Is that right? 1,700?
Yeah, there you go.
Okay.
Depends on if you took a lunch.
That is one thing that students ask. And Dr. Toon said, as a nurse practitioner, you're usually eating a sandwich and entering your hours on the charting. So if you are kind of working through lunch and eating and talking to your preceptor and you are sort of working through everything, then, you work through lunch. So, but if the office closes for lunch, then you can put a lunch hour in. Otherwise, you can just ignore that. And then again in notes, we saw 8 patients. Okay,
This is very helpful. I'm glad you're doing this.
Okay.
It's really awesome.
Thank you.
Oh yeah, no problem. No problem at all. Okay, so now you've entered your time log, so we're done with that. I'm going to go to the main menu. This one's old. I need to create a time log for that one, but I'll do it later.
So is there like a total hour somewhere so you can see where you're at during the semester?
Mm-hmm.
Like how?
Good question. Let's find out this question together. Okay, maybe it's this, case log totals. I think that's right. Okay, so we're going to put, oh, here, it does show everything. It shows everything here, but if you want to break it down by semester, you can do that too.
Oh, that's awesome.
Yeah. So not, it's going to show me a smaller breakdown, and you can also export this to Excel if you want to keep it in a file or however you want to do that. Yeah, so that's the best way to do that, I believe. Okay, next on here, at the end of, as you're going in the course, your instructors want to make sure you have all of your time and that you're logging your time. So we have a document. I think it might be, okay, here's the document. Okay, so that is, let me see. This is located on Blackboard, and it teaches you how to get your time logs and then upload them for your faculty to see on Blackboard. So I'm going to go through these directions with you. Let's see here. Okay. Activities and reports, we're going to click on My Time Logs. We're going to select a date range, so we're going to do just this spring. Course, so you're going to pick exactly which course you're in. So it'll be primary care 1 in the fall. I'm going to go ahead and use practicum. I think that's what I've been using. Make sure you click right here, show notes. That's going to show how many patients that you've worked with. And I'm going to apply the filter. And see how it shows up right here under notes. So you worked with 8 patients. Now, what your professor wants you to do is to view and export your results to Excel. So you click on that. It'll automatically upload, and I have one right here. Open it. Okay, and let me show you another one. I've already used that one too much. Okay. I always say, it says it might be corrupted, but I always say yes, so I still want to open it. Okay, this is what's going to pop up. So all that information you charted is going to be right here. And on the directions, the faculty noted that you can go ahead and delete columns H through P, so all the way through the end. So this is what they need. They need how many patients you saw and how many hours you've currently worked. So that's going to be, this is really the better way to see how many hours you're at for the program. And what you're going to do now, and it's in the directions, but you'll copy this right here, just the chart, and open a Word document and paste it in the Word document, and then you can upload that to Blackboard. In your individual course, it will have, on the left side of Blackboard, it will say assignments, and you'll click on that, and that's where you'll upload it for your instructor. Okay. I'm going to close that. Okay, so again, where you went to make that report is My Time Logs. And I think that's the best place to figure out how many hours you need remaining in a semester. Okay, so back to Blackboard. We've gone over clinical site information, preceptor form, Typhon, how to enter your time logs. I do have, this is for the program, for the entire program, you'll need several software programs. Let me show you. Okay, so Epocrates, you're going to use this whenever you are with your preceptor and you're looking up medications, and when your preceptor is entering the ICD-10 codes, if you get on Epocrates and you're looking up everything and helping them with all of their codes, that'll help you memorize everything, and it'll help you get faster as you go. So this is a really good site for that. I don't believe that every preceptor or every instructor requires it, but it is really helpful. And if you call this number and you give them your student email address, you do get a pretty good discount. Shadow Health, we're really not using that as much anymore. So you can ignore number 2. Typhon is where you'll look up your preceptor. That's where we just were, where we entered the case logs. It's an $80 one-time fee. I'll be sending y'all emails to invite you to Typhon next week. Up to date, it's a $35 subscription, and the subscription lasts for 1 year. And students have been sending a check for $35 made out to UT Tyler, and then you just mail it to my attention, and here's the address, and I can get you set up on that account. It's a link where you can go and search, different medical questions that you have. If you have a medical term and you're interested in to research it more, it's really helpful, and I believe that y'all will use it this summer. dermatology modules. This is now used in primary care 1, 2, and 3, and it's $150. But just something to think about in the back of your head that those fees are coming up. So, okay, let me close this document. Preceptor guide. If your preceptor asks for a copy of the preceptor guide, I have a copy, and what I do is I email it to them in their preceptor approval form that I send back to them. But if you need a copy, you can click on there and you can email them. Or if they're interested in reading it before, or if you want to include this in it does say thanks for agreeing to precept, but anyway, it's just good information for them. Okay. Do y'all have questions?
Well, you demystified a lot of stuff for me, so that's nice.
Okay.
Yes, thank you very much. This clears it up.
Yeah, no problem.
It's a lot to take in when you first start.
So what I'm going to start doing is I'm going to have one of these. I'm going to have 2 more in May, and I'm going to probably do 2 more in June. And, if you have any other questions, you can just pop on and ask me, So
That's really helpful.
Thank you.
Yeah. Well,
I think you've answered all my questions for now.
Okay.